trouble sleeping on Mounjaro, causes, what we know, and practical tips. Are you taking Mounjaro and finding it harder to get a good night's sleep? You're not alone, and there are some practical things worth knowing. Mounjaro is a medication licensed in the UK for type 2 diabetes. Some people taking it have reported sleep disturbances, and it's a question that comes up more than you might expect. So let's talk about what the evidence actually says. First, let's be clear. Insomnia is not listed as a common side effect in the official MHRA product information for Mounjaro. There's no established direct link between tirzepatide and sleep problems from clinical trials, but anecdotal reports from patients do suggest that some people experience disrupted sleep while taking it. One plausible explanation, rather than a definitive cause, is that gastrointestinal side effects may indirectly disrupt sleep. Things like nausea, abdominal discomfort, and delayed gastric emptying are among the most commonly reported reactions with Mounjaro, and they can be particularly uncomfortable when you're lying down at night. That unsettled feeling can make it genuinely difficult to drift off or stay asleep. It's also worth knowing that sleep difficulties can have multiple causes. Changes to your diet, shifts in your daily routine, fluctuations in blood glucose levels, stress, caffeine, and alcohol can all affect sleep quality independently of any medication. Pre-existing conditions like obstructive sleep apnea, which is more common in people with type 2 diabetes, can also play a role. If you're also taking insulin or a sulfonylurea alongside Mounjaro, it's worth being aware that nocturnal hypoglycemia can disturb sleep too, causing things like night sweats or nightmares. If that sounds familiar, it's definitely worth discussing with your clinician. The good news is that for many people, these kinds of side effects tend to ease as the body adjusts to the medication. Mounjaro is started at a lower dose and gradually increased over time, and that adjustment period can make a real difference to how you feel, including at night. In the meantime, there are some practical things you can try. Paying attention to when you eat in the evening can help. Giving your body more time to digest before lying down may reduce that uncomfortable fullness. Revisiting good sleep hygiene, a consistent bedtime, a cool and dark room, limiting screens before bed is always worthwhile. And if nausea is a particular issue, speaking to your doctor about managing it proactively could help you feel more comfortable overall. If you're struggling with sleep on Mounjaro, do raise it with your healthcare professional. They can help work out whether it's likely related to the medication, a side effect that needs managing, or something else entirely. Never adjust your prescribed dose without speaking to your doctor first. Seek medical advice sooner rather than later if sleep problems persist beyond about 4 weeks, or if they're accompanied by more serious symptoms like persistent vomiting, severe abdominal pain, or anything that feels unusual or concerning. You can also report suspected side effects via the MHRA Yellow Card scheme. There's a link in the description. One longer-term point worth mentioning, research suggests that for people with obesity-related sleep apnea, improvements in weight over time may actually lead to better sleep quality. So while the early weeks can feel unsettled, the picture may well improve as treatment continues. To recap, sleep disturbances on Mounjaro aren't officially listed as a common side effect, but some people do experience them, most likely due to gastrointestinal effects rather than any direct action of the medication. Symptoms often improve as your body adjusts, and there are practical strategies, from meal timing to sleep hygiene, that may help in the meantime. If sleep problems are affecting your quality of life, please speak to your doctor or pharmacist. This video is for general information only and isn't a substitute for personalized medical advice. If you found this helpful, leave a comment below. We'd love to hear your experience. And for more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel.